So when's your work days?
Actually, Manhattan.
I worked over there once.
Did you?
Of course, Forsyth, yeah.
ACS.
Yeah.
I don't
Okay.
know them probably the first.
Okay, we are live. We're live on YouTube.
Well, good evening, everybody. I'd like to call this meeting. Hi. Answer wave to all those sitting comfortably at home or different work location. So here we are, meeting all together, September 17th for our Senior Issues, Housing, Health, and Welfare Committee. My name is Ruth Greenfield Mazer. I'm the chair of this committee. And I'm very happy to call our first meeting to order for the year. We have two guest speakers, and I look forward to all of us learning a lot from them. Our first speaker will be Megan Shinneman, who is Senior Director, Research and Development from NYC Aging. So Megan.
First of all, I just want to thank you for actually getting my last name correct. That is very rare, so I'm impressed already. So I appreciate it. Thank you all for having me. As the chair said, I'm the senior director of research and development, working with Charisse at Aging. Oh, I don't know. I'm sure, Charisse, I don't know how many years you've been here, but I've been at Aging for 8 plus years. 8+ years. I'm working with many of our providers in different capacities, and our latest project here that I'm here to talk to you all about is our service needs assessment. It's something that we've been working on since May and are nearing the end, but still collecting information. So I'm really glad to have the opportunity to talk to you all a little bit about it, just to help continue to get the word out. It's essentially a 30 or so questionnaire that we're working on to really gather as much information about the needs and gaps in services, and what's working well and what areas we can potentially help our older New Yorkers 60 plus or caregivers of 60 plus. So really anyone that qualifies in that range, either the older New Yorker and or the caregiver, is eligible to complete this. It's not just for those that we currently serve, but it's also for those that we are not yet reaching. That's our real goal, is to understand both our current clientele as well as those that we're not yet reaching, because we know we serve a little over 200,000 older New Yorkers, but there's almost 1.8 million older New Yorkers in New York City. So obviously there's a lot we're not yet reaching. And we really want to make sure that all voices are heard, so we understand whether the needs are something that we can address internally in the Department for the Aging, or with our sister agencies through our Cabinet for Older New Yorkers, or beyond just the cabinet. And so the goal is, like I said, we've been doing this since May. The goal is to really complete through the end of this month, although there's potential to continue after this month if we're missing certain CDs or certain other community districts or neighborhoods, or even other populations. And so the survey's been up on our website. We have it both digitally, that available something called Qualtrics, but we also have hard copies that are available, and both are available in 11 languages, the top languages that the city requires based on the older New Yorkers. As I mentioned, there's about 30 questions, but that's skip logic. It doesn't always, depending on how you answer, you don't necessarily have to answer all of them. Some of the caregiver questions only need 10. It is anonymous, although we do encourage individuals to, at a minimum, include their zip codes, because that helps us identify the needs by neighborhood. And if people are willing to share their contact information, emails, or an address, there's a potential for entering a drawing for a $50 gift card. We have $50 gift cards that would be randomly selected at the end of this month. And so right now we're really getting our push to get out as many populations as possible. We've been to plenty of events in Brooklyn, thanks to Charisse. And we're really just trying to round out. I think right now we're a little over 7,000 responses, so we're doing quite well. But we know that we could do better, and that's why we're going out to these meetings and as many events as possible, as I mentioned. So I think I captured everything, but I'm happy to answer questions. And I see there's some hands raised and comments, and I can definitely share the link as well just to verify what you guys are sharing. But do you want me to? I can share the one pager, the survey, whatever is easiest. But happy to answer. Maybe start with questions.
Yeah, I think you could share both. That would be great, Megan. And then we'll call on anyone who has a question. Carmelo, you have your hand raised? Oh no, it's a mistake.
He was just raising his hands. He was excited about the survey.
Yeah. I'm sorry, Senya. Oh, Senya, you're on mute. Okay, good.
Good evening, everyone. My name is Senya Franjapani, and I am the Director of Social Services at the NIA office. My concern is what steps are being taken for seniors, the average Joe senior, who does not fall under the category of Medicare and Medicaid, because those are the seniors that seem to be suffering in regards to rental assistance, deals, housing, health insurance. Their measly little increase from Social Security has now gone to their Advantage payment. So what steps are being taken for them?
I can try to answer that, and I'm sure Sharice will probably want to answer that as well. So we actually serve all older New Yorkers, regardless of immigrant status, regardless of health insurance. Most of our services are regardless of income. They're not means tested except for only one of our programs. And so it's really anyone that's over 60 plus. Some of the concerns that you were talking about, we do either address internally or can connect you to community-based organizations that address a lot of that. We actually have individual direct programs that focus on health insurance questions that you were raising. We have a health insurance I'm going to screw up the name, Sharice, what HICAP stands for, but we do have a call-in number for that, as well as our New York Connects program that addresses long-term care and questions about how to get access to Medicaid, Medicare, or beyond. And housing questions, although we don't directly fund any housing programs, we work very often to get people connected to housing programs. So the average Joe, we only reach, like I mentioned, I think it's impressive that we reached over 200,000, which is about 11%, but the average Joe may be considered in that, I guess, what is that, 89%? So we want to make sure that they're aware of the fact that we can help access beyond just Medicare and Medicaid. So Sharice, would you want to add anything to that?
Say that you've covered it. Definitely emphasize our Aging Connect Contact Center for any resource information. That number is 212-244-6469, 212-244-6469, or 212-AGING, AGING, NYC. That's how you can also remember the number.
Can you write the number
we're
up
there
there on the screen? Is it possible to write those numbers?
I'm going to put them in the chat.
Okay, great.
Yeah,
Thanks.
I appreciate that.
We have
And then I
aging
would just-
specialists there Monday through Friday, 8:30 to 5:30 for to facilitate these kinds of questions and to refer internally as well as externally to programs and organizations, agencies.
What's your call, Sharice?
Aging Connect. Aging
Okay.
Connected is our
Okay.
contact center.
Okay, so we have a
Call center.
question from Todd Fleetner, who is so happy to have here, the Executive Director of the Bay Ridge Center.
Thank you, Josephine.
Yeah.
Megan and Sharice, so is this information going to be shared once it's tabulated, so we can kind of see shared to the masses, or I'm sure you're going to do stuff with it?
No, we're just collecting this out. Yeah. No, absolutely. I mean, I think there's a lot of different, ways that we're going to be using the information. I think part of this information could be used for upcoming procurements. Of course, it'll be included on helping us draft and understand what some of the services are needed, either the procurements that we have and or potential needs for seeking additional funding, whether it's public, private, through grants, if there's certain needs and gaps that are being not addressed. I think also we plan to bring this back, as I mentioned, to our cabinet for older New Yorkers. We'll probably do a presentation for the larger cabinet so they're understanding the needs and the gaps so they can address it from their older adult clients as well. And then I know we've talked about bringing it also, I'm not sure if many of you are familiar, we have an annual plan summary that we go around to different borough locations to present, and the idea would be to share some of that information and use it kind of as a dialogue to hear from people on the ground too. I think the annual plan summary, often we're speaking to our own clients and it's important to hear what they're saying, but also potentially, sorry, I might have a little visitor actually in the background. But I think that they it could potentially be brought to out there as well. I think eventually we probably will have the information published, but we'll, because it is a large information a large set of data that we're collecting, I think it'll probably be piecemeal. Like the full report won't necessarily be ready for either the upcoming RFPs or for the annual plan summary, but eventually we do plan to publish and share some of that information. Probably at the provider calls too. I'm sure you'll see it in different formats, Tom.
Yeah, I'm sure.
Right.
Thank you.
We have a board member with a question, Danielle Mowry. Danielle?
Hi, thank you so much for your time. I'm just wondering, I'm fairly new to this committee. I'm fairly new to the board. Is this a survey you do on a regular basis? And if so, like is this something new?
So we're required to gather information, and our team, my research colleagues and I, were constantly looking at information and trends on demographics from census data and other city data. As I mentioned, the annual plan summary, we do collect information to gather a needs assessment, but this high level of a survey to really reach as many people as possible, you could imagine, takes a lot of involvement. We are now in, I guess, the 4th or 5th month. So it's time consuming and does take a lot of time. So this detailed probably would not be every year. We've talked about revisiting. I believe the last time they did something similar was probably in 2019 pre-COVID. So we haven't done this level of an analysis since then. And even before that, I can't remember because I wasn't here, but we do collect data and try to understand the needs in different ways and are constantly having that on the ground feedback. So we probably will do something similar in the future where we're, gathering surveys and other information, but this detailed of a needs assessment, not every year. But we have talked about revising it maybe, every 5 years or something along those lines. That's my first meeting too. So we're newbies together.
I'm excited about the survey. So we'll task every committee member here tonight, as Cherise said, to complete the survey tonight. Homework, everyone. We're all going to do the survey.
It's really important. It really is.
Todd completed his.
Yes.
Oh, I did it right away. I want an Amazon gift card.
Do you have copies at the center that need to be brought back that we can help? Or I know that we started with you guys, so.
Right. Ahmed brought 100 or more back.
Right. Okay. We already have them in. Okay, great.
Yes. I got like around 200 and something.
Oh, wonderful.
So, tomorrow, I will encourage our members, the new members who didn't do the survey, we'll fill it out by the end of the month and I'll send them back to you.
Amazing. Yeah, as long as they're completed and we know that it won't get in, it probably won't get to us by the 30th, but as long as they're completed, just let us know, give us a heads up that, they're coming and that will make sure that they get entered into the drawing. I think the data will still be trickling in October and we'll see how people, if people are completing in October, but they may not get the drawing, but I still want to get their voices in there. And then I would just add again, we do have it, like I mentioned, in the 11 languages. So besides English, I'm trying to remember, we have Spanish, Chinese, Russian, Bengali, Haitian Creole, Korean, Arabic, Urdu, French, and Polish. So online, it's really easy to access all of those different versions. But if you need hard copies or one-pagers, we can definitely share that with you all.
How about Greek? You don't have Greek language?
Greek was not on I live in Astoria, so I know
You should have
Greek is an
Greek,
important
very popular. Nah.
but yeah, it's hard to get translated into every single language because we do have to go through a whole process to make sure that it's accurate. So unfortunately, we weren't able to do it in Greek.
I help you.
Okay, well, I'll remember that next time.
Okay.
Ahmed, I'm sorry, Ahmed.
Also, Beirut Center is having a big health fair coming up in October 8th. So it's
Okay.
going to be open to public. So if possible, maybe if you can send us a copies. So I can give
absolutely.
to each one who will, use our services, go to check the blood pressure, give blood drive. So they can fill up the survey on the spot.
Yep. Yeah, it'll be after our drawing, but we're happy to either send staff to help complete it or give you the hard copy, whatever it, whatever.
It's a good
whatever's
idea.
easiest. So just let us know and.
Yeah, that would be great.
We'll definitely coordinate that.
Yes, okay.
Before I leave today,
Yes.
we'll make sure. that
She's
we
our
know
champion.
how
She
to
gets
find
us to all the
event
events.
request form, so you can submit it.
I have a question. Megan, you mentioned how many seniors are currently being served.
Mhm.
And out of a much larger number. So does the city at this point in time have the capacity to provide services for additional seniors?
I would say yes and no. Yes, there are certain services that are under capacity that we definitely have the capacity to get on. Same for other, non-New York City aging services, right? It's important to get them access to other cabinet agencies that may have capacity to take on more clients as well. But I also think that gathering this information is also a tool to push and kind of advocate for more funding. If if it shows that indicate that the need is so much greater than what we have the capacity to serve, then you can use that as an advocacy tool to promote and say we needed more funding for whatever service that, the needs are indicating. So we do have some, capacity to serve in certain programs. It depends on the programs that we would be referring to where the need is based. But I think if the need is that much greater, I think you can also use as a tool to advocate for more funding. If funding allows.
Could you tell us again what the numbers were that you mentioned earlier? The number of people, of seniors who are served.
So originally pre-COVID, we were at 240,000. I think it's a little lower than that. I think it's about 220 now. So it's still about 11% of the almost 1.8 million older New Yorkers 60 plus. But we could still be reaching a lot better. And, we know that some of the other sister agencies are reaching more. I think there was about like 500,000 that were touching other programs and other city agencies. So, they are being served in different ways, but we're just trying to get a better understanding of exactly where the gaps are and where the needs are. And then you can use that for either a better referral system to areas that do have capacity to serve more, or again, to advocate for more funding or seek, public-private partnership to serve more as well.
Thanks.
Is that the number you were asking about?
Yeah, thank you. Thank you.
Okay. Danielle Mowry? Danielle?
Sorry, I have another question. Bouncing off of that. So is the population 60 plus going up in New York, correct?
Yep.
And so like how much and
I know that we are looking at the numbers and still trying to understand the projections going forward for the next 10 years. I know that we've talked about at the end of this year, all baby boomers will be over the age of 60. And we know that and we've already surpassed the number of older New Yorkers are greater than school age children in New York City. But it is projected, I think, Cherise, by 2040 to be 1.86 million. I'd have to double check the numbers. I think we report it somewhere in one of our reports. And that's, just projections based on the current census. If there are other changes in elections or immigration, of course, we have seen increases on that end as well. So that's just based on the current projections from our city planning is who usually projects 10 years going forward. So usually based on that, we're looking at least 1.86 million by 2040. So yeah, it's growing and becoming more diverse too. So that's another reason why it's super important to better understand, you know, where the trends are and which of the demographics and sorry, the demographic trends in each of the different neighborhoods, because, you know, 10 years ago, the city looked very different, and 10 years before that looked even more different. So language needs, you know, changes in family setup, et cetera. So it's important to capture these, which is why we hope to continue, just not every year.
Thank you.
It's a heavy lift every year, right? Right, Megan?
Yeah.
I'm sorry, what?
The heavy lift every year to do.
Yes,
do the
it's
survey.
been a heavy lift, but the team is small but mighty.
I have another question. On the paper I have here, asking people to do it, there's a QR code, but I don't see a website.
I'm not sure which one you're looking at, because the flyers we have should have both a link as well as a QR code. So if you don't have that, then we can definitely make sure you get that copy that has the link as well as the QR code.
Oh, it's,
Right.
so you go online and then you link, once you're online, no, I'm
Right,
just,
but we also have hard
I'm
copies
seeing
too
it.
that we're happy to get out to individuals.
Did we try?
no, I didn't, but I'm just saying that there are plenty of people who don't scan.
Right, so the
And then-
information is also on the website.
NYC.gov.
Yep. If you go on the main page, we have a carousel that kind of, I can show you the website too. I wonder if I could show you. I don't know if that's,
That's how portable.
do I have that capability here?
Yes, you do.
Okay, let me see if we
I
can.
guess while Megan's doing that, Senya, you had a question? I wasn't sure if you had a new one.
Yes, Josephine, I just, Megan and Sharice, on the, hard copy survey, is there a section that's strictly for, senior housing, or is that other?
On the Department for the Aging's website, there is a section for older adult housing. But I do have to preface that statement by saying we're not an agency, we're not a housing agency, but we do provide some resources on the
Yes.
website. There is a booklet, Alternatives in Senior Housing, which is a bit outdated. It hasn't been updated in a number of years, but the information is still relevant, and it is by borough. So if you go to the website and you can type in, if you would like senior housing or alternatives in senior housing, you'll find the brochure there.
I'm actually going to send it to everyone while we're on the call.
Thank
But
you,
I'll say the
Megan.
survey itself actually does have a lot of questions about housing. So let's see, you guys are Brooklyn, so I will send you Brooklyn.
IC.gov/region.
And that's not in Italian, right? I'd have to translate that.
Those are in English, yeah, but this is from 2019, so it is a little outdated. You know,
Okay.
I don't know if I can get back to you all without stopping to share the screen. So
But you can always contact our Aging Connect contact center as well with housing questions, and they have resources that they can provide that can hopefully be helpful. Community-based organizations that may have housing lists. And I think that's a good way to start as well.
Yeah, it's right here.
So just, I don't know if you all see, this is at the bottom of when you go to our landing page, this is the main Department for the Aging page. There's a spot, this is what we call our carousel. We're having an aging fair on Thursday if people want to come. We're very excited. But if you scan through it, you see that there's a way to access the survey up here. And then additionally, if you scroll down to the bottom, this is constantly here, the service needs assessment. You can just click on here and that should take you to the same link. And I'm gonna stop sharing and then send the link for the housing in Brooklyn as well. Our main web page. See, it's a good thing that I was calling in online, right?
Yes.
Okay, so I have the 3 links now I've shared, both for the main website as well as the direct to the survey in the multiple languages. You have the Aging Connect number, and then the housing information for Brooklyn in 2019. And again, you know, as you said, we do try to connect you to those, but updated information can always be, you know, reached out to us through our Aging Connect number or 311 as well.
Was that sufficient? Was that a sufficient enough answer for the housing question?
Yes, my dear.
Okay, great. There's always Housing Connect on the HPD website as well, so you can look there for any up and coming senior housing.
Any more questions for Megan? Okay.
I do.
Oh, maybe there's one more. Yeah, Danielle.
Can I get one more? Just because I noticed the rent freeze for older New Yorkers, is that also 60 plus? Or there's limitations to that, correct?
I
You
believe
have to
it's
don't you have to have
62.
like medical issues or something for rent freezes or?
That's through the Department of Finance. And are you there, Dawn?
Yeah, I'm here.
Right,
Okay.
so it is through the Department of Finance, and there is an income, there's income eligibility. If you'd like, you can call 311 for the Department of Finance. You can go onto the Department of Finance's website if you're able to.
Or you can
find
click on that particular part of your web, it'll get information for you as well, right? That's like all the information you would need is there as well.
Is
Correct.
there-
I just added in the link as well. Yeah.
Okay. Okay. And then just in case we're speaking with people in the neighborhood and stuff, how long does that usually take to take effect? You don't know. That's not
The
really.
agency, yeah, it's
Okay.
another
Yeah,
agency. We
okay.
don't know the
It used to be
timeline.
on our agency, but I think it moved
Long
out
time
a long time
ago, it was transferred. So finance has complete control of Spring and Dree, the
So what?
disability rent increase exemption.
Do you know
program.
the,
Bayridge Center has
Oh.
case managers who can help
Older
older
adult
adults with
centers.
that. All they have to
That's-
do is come into the Bayridge Center and we'll assist you.
That's so good to know because I mean, I'm just thinking about people I know in the neighborhood that are, a certain age and might qualify. So
Excellent.
Send them in.
That's right. Our centers do have folks on site to help. And even your local
Yep.
community board, your elected officials office should feel free if an older adult needs some support to inquire and ask if they can assist, especially because it's online and some people may need additional technological support. Oh, okay.
Okay, so thank you so much, Megan.
Yeah, thank you for having
What
me.
was the deadline? Did you mention for the survey?
So the deadline to be entered into the drawing for the gift cards would be September 30th. So I know we're very
Okay.
close to that, September flew by. I think if people are able to at least if they can't do it online, if they want to drop it off at their local senior center at Bay Ridge, as long as it's in by the 30th and we can figure out ways to get it back. But the responses themselves, we imagine probably will still be rolling in October. So that's okay. We just can't necessarily enter them into the drawing. So we obviously the incentive helps because I know it is a long questionnaire. So really the goal would be the next week.
Okay, thank you, because I'm thinking that's something when it's in my report that's read to the community board, people in the community board will be able to respond to the survey also.
Correct.
I mean, of course, we might have to let them know that they won't win a gift card, but
Don't tell them. Just tell them.
We
just
can
skip
change
it,
the
just
wording.
skip that information, right? Okay. Okay, so yeah, that's something important for them to know. Thank you for telling us, because I would not have known. And we'll certainly try to spread it around.
We appreciate it. Thank you all for your help and your engagement and lively
Yeah.
conversation.
and we blasted it out in our e-newsletter, so hopefully we'll get some, some readers, we have a few thousand readers, so hopefully some.
Wow.
Yes.
Well, kudos
Yes.
to Josephine and this
Great.
office,
Yeah,
because I remember when you guys started it.
I
from
know.
Nothing.
from nothing, and people
So-
sign up every day, which is great.
Oh,
Yeah.
wonderful. And you can also sign up for our
I'm-
newsletter.
Okay, good.
Okay, will
So,
do.
I'm
I'm
excited to-
sitting in the right place here.
Everyone has an e-newsletter
Great.
for the most part to stay informed.
Good. Okay, so thank you again, Megan, for
Thanks,
joining
Megan.
us.
Thank you.
And,
Everyone have a great evening.
You too. Thank you.
Take care.
you.
Thanks.
I hope we see a barrage of surveys.
Yeah,
Yeah.
so
Put in a particular.
Good, great.
I mean, we got a lot to do. We really
Yeah,
focused on
well, That's magnificent.
this. It was the mayor,
200.
he was the driving force, so.
So we're gonna move on now with our second guest speaker. We have Sharice Lawrence here from Brooklyn Government Affairs Officer for NYC. Aging, Office of the Aging. And we look forward to hearing all your stuff. I know you're chock full of information.
Well, thank you, everyone. Thank you for having me, Ruth and Josephine, and my friends to my left. So good to be here. This is what I do. I am charged with being the liaison to the community boards and to the elected officials in Brooklyn, throughout Brooklyn, as well as other stakeholders. So my colleague, Megan Shinneman, just spoke with you about something very topical. That's what I do pretty much at meetings. I let you know what's happening, what's coming down the pike. And let me just start by saying September has been a crazy month. It's been chock full of activities around our older adults. It is National Older Adult Center Month. And this year, for the very first time, the entire staff was charged with going out to a center and presenting a certificate in appreciation to our Older Adult Center leadership. So Bay Ridge Center got its certificate, I presented elsewhere, and then our other staff has been all over the city. In addition, this week is Falls Prevention Week. So Megan mentioned the Healthy Aging Fair. This is all happening in conjunction with Falls Prevention Week. So we're talking about health, mental health, all kinds of things, because we know that people who fall, older adults who fall, can unfortunately have very, very severe consequences, can lead to death. So we want you to know how to prepare your home for falls, how to avoid, obviously, a fall because it can be deadly. Additionally, I'm here to mention that next month we will be in the throes of our annual plan summary hearing. And you did hear Megan mention the annual plan summary, which, for the most part, we're asking everybody, whether you are an older adult, a caregiver, a younger person who is interested and concerned about the issues of older adults, to come out and to testify before the executive staff based on the document, the annual plan summary, which will be, the new version will be online perhaps within the next 2 weeks. But you have an opportunity to come out to speak directly to the leadership about the document, or it can be any other issue that you think needs to be raised and something that needs to be considered. This is for the record. It is the New York State Office for Aging that we report to. There are oversight in Albany. They require that we host these hearings citywide. And for Brooklyn, it will be hosted on Wednesday, October 30th at the J. Harama Older Adult Center, 2600 Ocean Parkway from 10 a.m. till noon. All of the hearings are 10 a.m. until noon, and they're all posted on our website. You may also see them in your local papers. So look out, because the ads, I believe, have been placed. Look out for it. RSVP, read the document when it comes out. But it basically contains the calendar or the schedule of the public hearings, an introduction to the Department for the Aging, an overview of the agency, lots of demographic information, and pretty much what we're taking from the data and sort of highlighting, like social, in the past it had been social isolation, mobility issues. You can again respond to these specific topics. Employment, we have an older adult employment program at the agency because we know that there are many older adults who need extra income. So we're there to support them. This program has been in existence, but it is always growing. You know, we know that the cost of living is very high here in New York City, and we have opportunities for them to return to work, to improve their skills, to do training, computer training, work on their resumes. We understand that even at Bay Ridge Center, they have an older adult, or maybe two, I don't know the exact number, volunteering. We have a Silver Corps program. It's a volunteer to work program. And within the past, I think 2 years that we introduced this program, but we've always had the CSEP program, which is for lower income older adults. It is income based, and they're able to work in service fields. We introduced also the Silver Stars program for those who retired from city government and need a little extra, and they can be placed back into the city government position. Of course, it's not full-time and it doesn't affect their pension. So that's been very attractive to city government employees who really, they retired, but maybe weren't really ready and they just want to still work and they want to still work for city government. But anyway, I digress. I'm just letting you know that this is something that was captured in the last annual plan summary. So I don't know what this year's initiatives, what they'll be focusing on, but it also gives you a little snapshot of the types of the different divisions and programs within the Department for the Aging. I am part of the Bureau of External Affairs. Megan is part of the Bureau of, I think it's, oh my gosh, I don't want to say which division because we did a name change, but she's in another division, PSI, which is the acronym, and I'm sorry I'm screwing that up right now. But we have the Bureau of Community Services, which provides the oversight to our older adult centers. We have the Bureau of Social Services and Active Aging, home care, case management agencies. They're overseeing caregiver support programs. And, this is all going to be in that document. Each year you will see this information in the annual plan summary, but there'll just be a little bit of a different focus in terms of what we'd like people to respond to. So please mark the calendar for October 30th. And when it's online, I will certainly give heads up.
Great.
You can take a look. You can, again, mark the calendar, try to come out and speak for 3 to 5 minutes. And just be on the record for what you think the issues are that are affecting this population and what the Department for the Aging should be thinking about as it plans moving forward. As we know, this service needs assessment surveys about unmet needs, gaps. How can we plan moving forward in the procurement process? So this is all, something that the annual plan summary is interested in as well. Mm-hmm. And for the hearing, we're interested in learning that and hopefully seeing how we can implement some of your ideas and some of perhaps changes or improvements. You can come out and say that some things are not going very well. It is pro and con. It's an open forum. But we do ask that you present written testimony if you can. Mm-hmm. If you can't, you can send it in a little bit later. But again, all of that information will be online. How many on this call know about the Department for the Aging being the largest area agency on aging in the nation? The reason why we're the largest is because we've got 1.8 million older adults, people who are 60 plus. That's nothing to sneeze at. And we're constantly growing here in New York City. So we're trying to accommodate through socialization at our older adult centers, case management programs for our more frail elderly population, providing them with home delivered meals if needed, home care if they need that because they're not able to actually, you know, dress themselves or bathe or cook for themselves, shop for themselves. So, you know, we've got programs that have been in place for many years and transportation programs as well. Some are attached to our older adult centers, some are standalones and basically take an older adult to medical appointments, social appointments citywide. And it sounds like, you know, by the nodding of Todd next to me, you know, he can definitely validate.
Absolutely.
So we're doing those things as well as we're trying to protect our older adults who may be victimized by elder abuse, whether it's financial, emotional, physical. We have an elderly crime victims resource center, an elder justice unit, and we work closely with our elder justice providers. You know, this is an agency that, like other city government agencies, partners with community-based nonprofits throughout the city, hundreds of them, to provide these direct services. So the elder justice unit works with our precincts, our district attorney's offices. It's important. It's important work, and we're doing that daily. And believe it or not, I get not a lot, but I get constituent inquiries from the elected officials, sometimes from the community boards, and on occasion there are elder abuse cases. I haven't seen any in a little while, but there was a time where I was just wondering what's going on. But during COVID, I think we saw a spike. People were in the home together.
Right.
Things were happening. So it's a very necessary program.
Excuse me, I remember last time you were here.
That's right, I was here.
Yes,
Mhm.
yes, this is a return visit.
Mhm.
Appreciate it.
Sure.
And it gives a chance to follow up on some of the things that
Absolutely.
you mentioned. And what you mentioned last time that ties in what you're saying is that the department has a respite and support program for caregivers.
Mhm.
So maybe
That's
that's been
focus.
helping.
It's been a focus of our agency. We have seen, and you've probably seen on the news, some of the interviews with the Commissioner Lorraine Corte Vasquez on caregiver programs. We're promoting it constantly because we know that people can often be very stressed from caring for a loved one with dementia or chronic illness, and they need to know where to turn. And we've got caregiver support programs in place to give them just what it is that they're needing, which is information, which is maybe sometimes some equipment that they may need to help that person be comfortable in the home. Additionally, just respite, a little break.
So the caregiver support program is really for
In case
the family member.
It's for the family
who
member.
is caring,
Mhm.
and they can have respite
For the caregiver.
for the caregiver and with maybe sending in a substitute or is that?
I can provide the information for the caregiver support program for your district,
Mhm.
and you can speak with them a little bit more in depth about what all they can potentially provide to you. Now, I'm not thinking right offhand who it is. I don't want to misspeak. I'll look it up for you. For Community Board 10. Is it Heights and Hills?
I believe.
It might be Heights and Hills. So I'll double check that for you. And someone there, a social worker, can tell you all about as part of its
Okay.
program.
Right.
Mhm. But we do know that the numbers are growing, that more people need support in the home or just with navigating how to care for a loved one who is obviously challenged by, you know, some chronic illness or terminal illness. So they can reach out to us absolutely through our Aging Connect line. Again, it's 212-244-6469, and the specialist can tell you by zip code, it is by catchment area. They can tell you which caregiver support program is the one for your area.
I remember when you were here last time, you told,
That's amazing, Ruth.
I have my notes.
Oh, great.
So I'm cheating a little
Well,
bit,
that's fine.
but, you're speaking of the Aging Connect line like it's been there forever.
It has.
But I know, because I remember during our last meeting, you told me that told us that it was going to be starting. So
I believe it had
it
started.
started, well, and maybe it was just new to,
3 years now. It's still our baby, but it's been about
Yeah.
3 years. And it was the vision of the commissioner to bring something to that population so they didn't have to call 311 and they would get more personalized attention and the resources that were going to be tailored to their needs. So it's not that we don't work closely with 311, but we do have our own operation.
that's great.
Some calls are referred through
Oh, that's
311 to us.
Yeah.
And again, it's Monday through Friday, 8:30 to 5:30, and it ranges. Housing is our number one call, but I have to continue to emphasize we're not a housing agency. But we can take the call and hopefully provide some information that can get you on your way. Mhm.
Senya, we have a question. Senya, you have a question?
Yes, Sharice, for the support group, is that free or do they need to have Medicaid and Medicare?
No, none of that. It's not a means tested program at all. But the
So it-
caregiver program, caregiver support.
Yeah,
Once you call, they will give you more of the specific details. I don't have that
the
information.
protocol. Okay.
Yeah, but no, there's no transactional.
Great.
Free.
It's free.
One of our
Right.
favorite words, right, Sharice?
Exactly. We're city government.
That's really great.
Yeah, we're city government. So.
Danielle?
I'm just curious. I don't think I heard you mention either of these things, and maybe you have them or maybe you don't. Are there any special programs going on about deed theft? And also, is there anything in terms of outreach for voting registration or getting to the polls that the department's doing?
Okay, so the deed theft. A question like that would likely come through our Elderly Crime Victims Resource Center, but we're not
Specifically doing that.
We
Right,
would
okay.
refer that. We're not doing that work internally. Probably eventually it would go to the DA's office and maybe even the AG's office, because I know that she now has something
Yeah, I
on
think
there.
Speaker Adams is doing stuff too, like she's doing.
Yeah,
some
because
stuff,
it's a very big issue among our older adults, and specifically like in Central Brooklyn, I know that they've for years have been talking about deed theft, but something seems to be getting done on a more punitive level. So I think that they're going to be prosecuting these cases.
Yeah.
Moving forward. Now, the second question was about voters. So
Yeah,
one
is
of
there
the
any
things I
programs
know
for
that we're
voting?
doing is we're taking voter registration cards out wherever we go. But we do have a civic engagement commission, and they do, through the city, they do a lot of the voter registration information and civic engagement, participation, presentations. So that's more.
They would work with you if there is a certain focus.
Of course, they would work with us.
Okay.
But yeah, that's pretty much we're taking those voter registration cards out, and I say, I know it's not for you, the older adult, you're registered likely, but if you're not, but for your grandchild or your great grandchild,
Or if they've moved
or
to
neighbor,
a center or something, they relocated,
absolutely,
changed there. Yeah.
absolutely. But we are taking them out to our events because we know that it's important to share that information.
Thanks. Good to know.
Yeah,
Thank
and
you.
that's Community Board 10. We have voter registration here as well.
Thrives.
And, yes, we do. We are grateful the Board of Elections also part of our charter mandate. We, for anyone listening at home, we have voter registration forms here in multiple languages as well.
Excellent.
Yeah, great.
I don't
I'm
think
just
so.
kidding.
Oh, Dr. Ramawi, you had your hand raised? I see it down now. Did you have a question? Dr. Ramawi, you're on mute. Okay, well, he put his hand down.
How is
Okay.
it now?
It's
Okay.
good. We can hear you, yes.
Yeah. For that meeting on October 30, is there any way if I give you my email, you can just send me the headlines of the topics which will be discussed? Because I'm gonna inform the people in our center about it. So if you just send me that the headlines of the parts which will be discussed in that meeting, if possible.
As soon as, well, it's what you'd like to discuss, quite honestly, but we do ask for those who are attending to respond. We ask you to respond to the annual plan summary document, but you don't necessarily have to. You can speak about something else that is.
I
Yeah,
see.
we'll have that information.
Okay.
Dr. Ramawi, I will send that out with the annual
Okay.
plan summary. Okay, very good.
Yes. And
Very
we
good. Thank
have
you.
had very
Thank you.
successful annual plan summary hearings in Brooklyn. We tend to pack it out, and we do get a lot of our elected officials, representatives. And we're hoping to get more of the principals this year.
That's great.
Yeah, and you can come out and your colleagues have
Yeah.
done so as
Mhm.
well.
I have a question.
This is last year again.
Oh, it's last year.
Yeah, because it's not, the new document is not yet posted.
Okay.
So I brought
That was
last year.
Last year's, yeah.
Yeah, so yes, 2600 Ocean Parkway
Parkway.
for J. Harama Older Adult Center. In response to Senji.
Yeah.
Senja. Mhm. And I think the last time I was here, I mentioned the older adult liaisons, and I do remember the older adult center director saying, wow, they didn't know that that program existed.
Yeah.
So at every one of our precincts, we've got older adult liaisons. These are actual crime prevention officers who are assigned to handle issues, concerns that are brought to the precinct by an older adult. So they've got someone who's designated, and sometimes they have to reach out to us. Sometimes they handle it on their own. I've been talking to some lately, and they're doing their own thing.
Yeah.
Because they're really becoming very educated and informed about the resources and about the agency, what we do, how to help them, and it's going very well. We've even had them judge our recent competition of Talent is Timeless, which is something else I'm supposed to push. October 10th is our citywide. It is the finale of our Talent is Timeless competition. So our older adult center members have been competing for months to get to the citywide finale. We just had the Brooklyn show last Tuesday, and on Thursday, October 10th, I think that's a Thursday. And yes, at the United Palace Theater in Washington Heights, on the grand stage, you get to see
The best of the best.
the best of the best compete for that grand prize, and I guess another couple of prizes. But that information is on our website as well.
Busy day.
On the homepage, and there are tickets that are being distributed. I think it's one per person. So I can also share that with the board. But this has been 2 years now that we've been doing Talent is Timeless. It's a great showcase of the talent that our older adults have. We want to always promote the vitality of older adults. And you're probably hearing me say older adults a lot because we don't really use seniors.
Yes, according to the Department for the Aging, the S word is a bad word. Like, we cannot use the S word anymore. We cannot say senior. So,
Older adults. Yeah.
older adult.
And our centers were known as senior centers. We call them older adult centers. You may see a lot of acronyms, OAC, that stands for Older Adult Center. So if you see that after the name of a center, it stands for Older Adult Center. I'm here for questions, please,
Okay.
please, because it'll tell me what I've not told you. It'll inform me as to what I've missed.
You cover a lot of territory.
No, yeah, those.
Did I?
Very
Well, I
nice.
guess because we've had so much going on, I started with
Yeah.
that, and Oh, did I mention? Yeah, I did mention the National Older Employment Week or something along those lines. Yeah, it's called, and I didn't even know about that until I saw it
Oh,
posted.
National,
Social media, if you're on social media, follow the Department for the Aging social media page. I think it's at NYC Seniors or Aging. I think it's NYC Aging. Yeah, no more seniors, but I think it was seniors. So National Employ Older Workers Week, that's what this is. And yeah, that's pretty much it.
that's great.
Are you a member? Is anybody on the call a member of an older adult center? Oh, Sandra has another, no, that's not Sandra.
Danielle?
Danielle has a question. And there's
No,
another.
I have another question. I'm not a member of an adult
Okay.
center, but
But you're an active older adult. And
just an
engaged.
adult. No, I was going to ask a question though. Like, do you get calls from your agency about ageism in terms of hiring?
I don't know about the calls that specifically come in about ageism, but we know that ageism exists. It's been part of the mission also of the agency to combat it. And through the Cabinet for Older New Yorkers, which Megan mentioned, is comprised of other city government agencies and their leadership. They're always talking about policy changes and ways in which to improve the lives of older adults, from their agency standpoint, what they can do in collaboration with the Department for the Aging. And one of the things that at the outset of the Cabinet for Older New Yorkers, they took on an initiative with the Department of Education to educate high schoolers about ageism. And I know that as a result of this cohort, it was a semester long or so, there's supposed to be some kind of resource guide. I've not seen it, but I know it's something that they've worked on. But really it was about getting the younger generation to understand what ageism is all about and how to identify it and how to combat it. But ageism is something the commissioner does talk about a lot, which is why, our older adult workforce program is so important, because we want to make sure that older adults, who are trying to return to the workforce are treated with respect and dignity. They're placed in positions where they can definitely feel that
So that the workshop comes from your Department of Aging.
Which workshop?
The high school, the ageism
Oh,
workshop.
yes, that was the department, that was Aging and the Department of Education. And they were piloted, it was piloted in some Brooklyn high schools.
Is there any partnerships like that?
To my knowledge, it's over. That was
a
while ago.
Were there any other partnerships like that with small business services or anything like that?
Well,
Or
I believe they're part of the Cabinet for Older New Yorkers, but I'm not sitting in on those meetings to know what's coming out of it. Occasionally there will be updates that we'll receive, but I could not tell you very definitively what's happening right now.
Okay.
As it happens,
Happens.
I got an email the other day from the American Society on Aging, and October 9th is Aging Awareness Day. And October 9th. And Josephine, I can forward you this email because it has a link. They can tell you all kinds of things, how to get, So I'm going to send it to Josephine so she can share it. Want me to send it to you too?
Yeah.
Yeah.
Aging Awareness Day.
Yep.
National
American Awareness, Aging Awareness Day for the American Society of Aging.
ASA.
So, yeah. So there you go.
I'm just going to add in though, I just want as a non over 60-year-old person, the ageism work does not. No, not everybody on this. Not everybody. You don't have to be an aging person to be on the committee. You don't have to be like an older.
Okay. I didn't.
Yeah. I think the ageism education is really great because honestly, in some of the industries in New York City, ageism starts in the 30s.
I agree.
So I think the ageism across the board, not just returning workers, but that attitude. It's great
You
that
have to
you're
drop the age for ageism at this point. I agree.
right. Ageism starts depending on what industry you're in earlier and earlier.
Right.
Right.
Good point, Danielle.
That's
It's
a very
true.
good point. And I believe that was brought up today
Yeah.
too in the hearing
Mhm.
that nonprofit versus private industry,
Yeah.
where you can see the difference sometimes.
Big in dating.
It's big in dating. Was it? There was another hand up. I did.
And was there anyone
Was
else
it
with a
Sandy?
question? Sunny, did you have another question?
No, my dear.
Okay,
Oh,
okay.
Danielle, feel free to ask another if it's okay with the chair and
I think I had my quota. I don't know.
but there is you can go to our website and you can type in Cabinet for Older New Yorkers. They should have any updates on the website, but they're within our agency, and this was something that again the commissioner and the mayor decided would be a good effort, a good initiative, because so often what we do, we need other partners, other city government agencies to work with us, to advocate and to, obviously implement some of the policies that would improve the quality of life of older adults. We can't always do it alone. We can't work in a silo. So we try to be as collaborative as possible. And I think that's what this is about. And it is the only one that we know of in the nation.
Yeah.
Yeah.
Can I chime in on a more positive note?
Yes.
I do. I
Oh,
do
that
a
wasn't positive?
No, your thing was positive, but my last comment about ageism was probably not the most positive.
Oh, okay.
But I do a lot of work with citywide participatory budgeting, and I go around and do the idea workshops and stuff. And I just am so heartened whenever I'm in like a middle school, like McKinley in our area, or a high school. These kids come up with so many ideas that talk about older adults and wanting to do things with them or for them.
Right.
And it's just so touching and so nice to hear when they come up. And some of this stuff is really cool. Like, I think one of the winning ideas this year ended up being like teaching teenagers how to do home repairs or home work in a home, and then having them help the community, like having them go out and like help change light bulbs or rake leaves or something for people in their community. So, it was very sweet to hear.
It's intergenerational.
Yeah, I think the intergenerational work is great. So I have sat along with Todd from the Bay Ridge Center on an age-friendly initiative. And over the years, we had lots of focus groups, lots of meetings, but I think some of the greatest some of the greatest ideas from the focus groups were really about intergenerational, whether it's, I thought that was great, Danielle, helping to do, fix-it jobs, but also language, students who are learning a second language, partnering with an older adult that's fluent in another and having conversation, just generally learning about, different ways to be supportive. And in Bay Ridge, right here in Board 10, our older adult population, want to be correct, yes, is, one of the largest in the city. So, I mean, I think in the next 10 years, we'll probably be close to 20%. So it's important for us to continue to make sure that our community, thrives and is age friendly, and we have great groups that can, and older adult centers, state of the art, that can work with this population. And I think we could do so many good things as a community together. So it's so important. And this information is very helpful. And at one time it was an identified need. I mean, we still have lots of needs in our community, but
meeting them.
Yes, we are meeting them.
Very good. So, another concept is the naturally occurring retirement
Communities,
community, which is
Bay
Ridge.
Ridge,
Yes, definitely.
We were in Newark before there was even an
I
acronym.
remember
Right,
that.
yes.
You were neighborhood North, NNORC.
And then, yes, that's right.
We are in a plan of doing an intergenerational activity in October by the request of some of our members, and also from Newark members. So we're gonna do it on Saturday. We're gonna invite like all the adults, their grandkids or whatever. It's gonna be like a big event.
That's
We are
wonderful.
finalizing the flyer.
It's big
Yes.
for you all.
Yeah.
From what I'm hearing, already it's a big event. So what I have been hearing about forms and filling out things before. The information in ample time, so try to give us at least a 3-week thing. Okay. That's for anyone on this call too. If you're part of another organization and you need a presence, you know, we do ask you to complete that form and you take it from there.
Oh, wow, this is a lot of information. So I want to thank you very much.
Thank you for having me.
Yeah. So, we have another topic, Josephine, for you to update us on the, senior directory.
Yes, so a number of years ago, the Senior Issues Committee, along with Age Friendly Initiative, we put together a senior directory and a resource guide, which Todd is holding up. And we are in the process of updating that because it's the number one ask of seniors in the district. They want to have something in their hand. And the Bay Ridge Center has been gracious enough. We're going to be working with an intern that's going to work with us to help get this done in the next couple of weeks.
Meeting
We're
Wednesday.
meeting Wednesday about it, so I'm very excited because I do think it's important. And part of the in addition to the local resources that are available, we had local merchants who provided senior discounts. And so we were able to put that all together. And we, last time we published that was before COVID. So it's been some time, been lots of changes. So we're excited about this initiative and this effort to update it. And we had a small 3-fold pamphlet that we found too earlier that could need some updated, our age friendly, what it's all about. And it's so important for us to communicate to local seniors. And we're just really happy that the Bay Ridge Center, we're going to partner again to get that completed. So I wanted to share that with the committee members. It's an exciting project and one that's a real need and appreciated by local seniors in the district.
By chance, what are they? I'm remembering those
Are
meetings
there-
down in the.
Are there houses of worship listed?
Yes, yes, that's all included. Houses of worship, nurseries, schools, resources, elected officials office, contact information, all the agencies, aging, sanitation, we're gonna, put that all in there. So it's a one-stop, who to call,
Food pantry.
food pantries. Food pantries is very big, yes. Yes, yeah, so we have a lot of this information on our website, but there is a big digital divide in the community, and it's one that we've been working to kind of close a bit, but again, it's incredible to me how many, older adults come and say, we still have your senior guide, it's on our refrigerator, but the information is outdated,
Bridge the divide, are you gonna put a QR code on it?
Yes, yes. Yes.
She said they're doing it.
And in terms of future meeting topics, we had also discussed the Bay Ridge Center has been up and running now. We had a briefing not too long ago. Many of us have been to the grand opening, but some of the committee members have not been there. We were at the board meeting. We have a board meeting there this month at the Bay Ridge Center. Our next October board meeting.
Oh,
Yeah.
like,
I'm like, wait, we're not in October yet. Next month, yes.
Don't scare me.
Yes,
But we
yes.
want to add more to your October.
No, yes. Actually, there are two meetings at the Bayward Center in the month of October, I understand, the Community Board and the 68th Precinct Community
That's
Council.
right.
That was announced at the last meeting, so Bayward Center is opening its doors, and we thought perhaps maybe sometime in the future, we can actually see the center while its activities are taking place. It might be a nice committee field trip if anyone's interested.
Yeah,
Well, I've seen it in action. I
Yes.
really like it. Very nice.
Yeah. So do we know when that might be out?
The,
The resource?
probably this spring.
yeah, I would say
Spring,
this
this spring.
spring, yeah.
So, I have a question for you, for both of you, from representing the Bay Ridge Center.
Yes.
When I came in, you mentioned the special day that's taking place on October 10th.
Or October 8th.
Oh,
yes.
I'm sorry, October. So could you tell us all about it?
Yeah, Ahmed's, he's the man behind it, so
Yes.
go ahead, Ahmed.
So it's gonna be a big health fair. We partnered with different kind of hospitals such as Maimonides, NYU, local health centers here. So they're gonna do foot assessments, hearing aid. Also, we partnered with American Red Cross. They're gonna give like tips how to prevent, smoke detectors and those stuff when they see smoke. So it's all related to health. Plus, we reach out to NYC blood drive. They're gonna do blood drive from age 16 to 75, and then from 75, they need to bring notes from their doctor. So also, we're gonna have we partner with NYU Langone. They're gonna do flu shots. So it's also gonna be open to the public as well. Plus, blood pressure. We're gonna perform also at the center. Dental screening as well.
Oh,
So it's like a full kind of a big health fair on that day. It's gonna be from 10 a.m. in the morning till 3 o'clock p.m.
oh.
And it's October 8th, and Tuesday. Gonna be, and it's open for everyone. Please spread the word.
Did you think about having anybody representing the organizations that do stem cell transplants? The Gift of Life.
That's a good,
I mean, a lot of your seniors might be too old for it, possibly. I don't know what the age requirements are, but I believe that that's something that should be included a lot more in all of these things, because a lot of people don't know what it is. And in order to screen, it just involves a cheek swab. So there are a couple of agencies that come out. We had that once at Bay Ridge Jewish Center. They came out, they swabbed, they do all that. But the most important thing is that at least they give out the information and then family members can see it. I mean, I'm a big proponent of this because my husband had 2 bone marrow transplants, also called stem cell transplants, which saved his life. So,
So we were
really
planning,
important.
this is a good thing, maybe we can have it in the future, next year. We were planning to have mammogram, but unfortunately, it's like 3 or 5 months in advance to book that thing. But however, we managed to have a health mobile screening van will be coming from Salon Catering Cancer Center in Manhattan. They will be also at the front door of Bay Ridge Center. They do different kind of cancer, some way of a cancer screening. Yes.
but Ruth,
But this
that's a
will
good
be
thing
a good
for us to
thing.
look into moving forward.
Yes.
I don't think it necessarily would take, it's either someone's available or they're not. It's
Now, is
not-
I'll try to reach out to
So
more.
there were 2 organizations.
Is it live on?
What?
Is it live on? Is that one?
Maybe, I don't know that one.
We have Ahmed has a number of really good contacts, so we'll follow up on that, Ruth.
Okay, great.
Yeah, I think that is important.
Yeah, but
My
testimonial.
niece 2 weeks ago had surgery. She had surgery on her jaw. And they actually took stem cells from another part of her body and used it in her jaw. It was like, it's amazing what they're doing with stem cells now. You know? Yeah. Mhm. And your own June Johnson has helped us coordinating the blood drive, of course.
And June Johnson used to coordinate the stem cell
Stem cell,
drive
yeah.
at the,
Thanks to June.
at the school,
Always.
Yeah.
one in memory of her son.
Yeah, yeah.
Okay, we'll definitely.
You probably know her from the community board.
Yeah.
And she's done a lot of things, this thing with running,
Okay.
and there's some kind of like senior running thing.
Yeah, on the weekends, the road runners,
Yeah, they have a
seen
senior,
it, yeah.
they have an older adult.
Older adults, yes, we're getting it. the older adult.
Every weekend?
Well, the road runners does a run every week, and June volunteered for that, and she she actually did a lot of outreach to local seniors to participate in that each week. I don't know if she's still doing it, but she,
Yeah,
did it
she
for a
could
very
come
long
and tell
time.
us at the
Mhm.
board. I miss
Yeah.
her on the board.
yes.
Very nice.
All right, well,
Okay.
that's a big day at the Bay Ridge Center.
Yes,
It's gonna be-
So, do you have flyers for us?
yes,
Yeah.
he already sent them. to
We sent them,
Joseph.
and they're in the
Oh,
newsletter,
okay.
and
Okay.
yep, we're in the
Okay,
newsletter.
great.
We also promote it on our social media as well. And we also tag.
Oh.
And you know
They
what?
always tag NYC.
I'll make sure I send it out to the board, so you have it.
So I
Okay.
send it out actually even to Fifth Avenue bit
Great.
as well, so.
And there's a big fair on Sunday, right? Third Avenue Festival.
Third Avenue Festival is this Sunday, yes.
Oh, yeah, that's a great.
Ragamuffin Parade is
You know-
Saturday, and the festival
You know,
Sunday.
that's an
Weekend.
excellent place
Busy, busy.
to have a table.
Mhm.
Are you having one for Bay Ridge Center?
We always do that like in front of the next Spanish Connects.
Mhm.
So we have our tents and
Mhm,
tables.
Yeah.
This year I have to touch base with Ashley, the director.
Mhm.
Yeah.
Plus, that's a great place to advertise, not only 10-8, but the,
Mhm.
yeah, what's it called? Oh, here it is, yeah, the service needs assessment.
Oh,
To have copies of the service needs assessment and,
There's so
Yeah.
much going on.
I know, it's a
Yeah.
lot.
there is.
Those are
Bay
great.
Ridge is very popular.
Okay.
I have one other question one other topic that I'd like to bring up. And that is, this is a very broad community. You know, we talk a lot about senior issues, which we may have to change the name to older adult
Adult
issues.
issues, yeah.
Okay, we're behind the times here. Seriously, we
Yeah,
should have
you're
a-
right,
We
yeah.
should have a vote
Vote.
on that.
Okay,
Could we do that?
we could do that.
So we're,
Oh, my,
we-
the influence.
we're in quorum, so would someone like to make a motion to change the name of this committee from Senior Issues, Housing, Health and Welfare to Older Adult Issues, Housing, Health and Welfare?
So
I'll
Carmelo
make that
has, all
motion.
right, thank you.
I'll
We
make
need
the
a sec-
motion.
Okay, we need a second.
Oh, it was just seconded,
Estella,
so,
yeah.
okay, so, all in favor? Oh, wait, is there any
Aye.
discussion? Wait, I made a mistake. I apologize. Is there any, discussion?
No.
Okay,
Well, I
because
don't
we've been
have any.
discussing it all night.
Okay,
So all in favor, and this is a vote for board
Aye.
members only.
okay. Marie's and I, okay.
Okay, are there any, opposed? Put your yellow hand up if you're opposed.
Okay,
Are there any abstentions or recusals? Okay, it looks like it passed.
We have a new name. You have a new
Yes.
name. Wow.
well, it has to be voted upon by the full board,
It'll
so.
be presented to the board. So, segueing from that, I wanted to bring up that where Senior Issues Housing health, and welfare. So with that in mind, I want to ask everybody, what kinds of topics would you like to see us discussing, working on in this coming year? It could go beyond senior issues because, we have our committee could really be divided in three. Senior issues one, health and welfare one, and housing. And clearly, we're not going to do everything. But, if anybody has any thoughts, let's,
We could talk about it now, if people could send it in to us,
yeah.
think about it.
If anyone has anything now.
Danielle?
I just wanted some clarification because I know we weren't at all involved in City of Yes with the housing aspect of it. So just explain to us so we're clear, like where those dividing lines are, because that's the zoning committee, correct? That was
Yeah,
like-
so the zoning committee reviews all text amendments, specific applications, that require review of the zoning text. In the past, the committee has worked on mostly there's a senior housing, initiative or survey, or, for example, the, senior housing that's opening up in the district next to us. We've, talked a little bit about that, have had presentations in the past. The health and welfare, we worked on homeless issues. We've, invited DHS in the past to come to speak before the board, participated in the annual count, Hope Count. I'm just giving examples of different works the committee has done.
Well, last year we
more
did a whole thing on e-bikes.
Right. So e-bikes, we've done vaping forums,
Yeah,
where we've combined with, we've connected with other committees of the board. So these are the types of topics that this committee has addressed in the past.
But getting back to your question, the City of Yes was really worked on so much by the Land Use and Zoning Committee and was discussed by the board. Of course, we all have an interest and things to say about that. And Josephine told us at the last meeting where it's at in progressing along.
Right. Yeah, no, I just wanted to be clear on where the dividing lines were for that. Because also, like when you're saying housing, it's not just older adult housing for this committee, right? It would just be housing in general.
Yeah.
Okay.
Yeah.
All right. Yeah, it is a big committee.
Yeah.
Yeah. I mean, I don't think, I don't know. I'm just going to wait and hear from, I was going to say something, but I have nothing to say.
Okay.
I'm going to wait and hear what topics people want to have an
address.
interest in.
Okay,
Yeah.
that's great.
Because I think,
Very diplomatic.
well, I think every
Right?
year, we kind of have a focus. Like Josephine mentioned, the vaping was a big focus one year. I don't think we solved the problem, frankly. And with the the cannabis places trying to open and all of that, I mean, we know. So, all right. So if no one has anything, and there's no saying we can't, stay with older adult issues. Yes,
I know I'm not a board member, Ruth.
we
But
wish
something-
you are.
What?
We wish you are.
I know, and
Yeah.
I will at some point because I was almost hit on the way over here by two bicycles. They're riding bicycles on the sidewalks, these motorized things. To me, that's something we have
We
addressed in
are-
connection
yes.
with age friendly, but
We are
it
working.
is
yeah.
such an issue. I
I
have
agree.
people come up behind, by the time they're going past me, they've almost knocked me over. And they're like, it's just like, it's crazy.
If I had
It's
to
great.
share, I think we did at the last board meeting, which was just last week, the number one issue coming into the district office is
Right.
and we are working on actually a
So
round
is
table.
that under welfare or is that part of police and public safety.
I would say it's all. It's traffic and transportation, it's public safety, it's senior issues. I think all, many committees of this board are concerned and more, and it's not only our community board, and speaking to some of my colleagues and other boards, this is really becoming a citywide issue, and one that I think we've talked about it as a board, taking some, thinking about, and I think one of the board members said, I don't even know what to do, right? Because it's become such an overwhelming
Well,
issue.
how about when you drive?
Yeah.
When you're driving, and these people are not in bike lanes, and if they
No.
are, they're going the wrong way.
Right. No, it's a safety
they
issue
come
for
up
all
around
users of the
your
roadway and
car,
pedestrians.
And they're not
it is
lit
a big-
up.
Right. So we
It's a
will be
community
the issue. Yes, for sure. Thank you.
Thank you.
Yeah.
So someone from Bishop, so maybe.
Okay, so, is there any, new business that anybody, I guess that was sort of new
New
business.
business.
We did that, right? Okay. Is there any old business that anybody wants to bring up? Okay, I think we did that too,
Right.
actually.
Then we just need a motion to
So
adjourn.
now we need a motion to adjourn. Would someone like to make that motion to adjourn?
Everyone wants to stay.
You will want
Okay,
to-
Dr.
oh,
Ramawi.
Thank you. Anybody second
yeah.
that motion?
I saw
Okay,
Danielle, just a whole bunch of
Danielle.
seconds. All right.
Thank you, everybody.
Thank you all. Have a good night.
Very good meeting.